Hey guys, this is Dr. Hub. Today we'll look at the differential diagnosis of the lesions of the spine. So to begin with, first is the older than 40 years of age. So in this category, there includes metastasis. Next, there is also the presence of the multiple myeloma. Next, there is also the hemangioma. And also the chondroma. So this is an age group that is greater than 40 years. Now when we look at the younger age group, that is less than 30 years, what do we have? So under less than 30 years, it includes under the vertebral body, so here there is histiocytosis. Next, there is also hemangioma. Next, in posterior elements, that is the ostride osteoma. There is osteoblastoma, as well as the aneurysmal bone cyst. Aneurysmal bone cyst. To learn and grow daily like this, please do subscribe.